Muli,
Yes.
you're a young Kenyan man. Where did this passion for hair come from?
I don't know. And though when I was young, I used to keep an afro. My father used to keep an afro, but I really never knew that I had the passion for hair. I think I have passion for everything that I do. I used to be a garbage collector, and I used to do it so well.
You're kidding.
Yeah.
You're kidding.
Yeah, so I think I got into the industry and I realized there were gaps and there were so many questions that were unanswered. And I said, I am the one
to do
give the
that
answer.
work.
Yes.
All
yes.
right, but Muli, what gaps did you notice?
Let me start by how I started to work as a hairdresser, because I trained in Nairobi as a hairdresser. Then I actually started working in a salon in South B when I was still a student, a hairdressing student. Then when I finished hairdressing, my father actually passed away a month before I graduated. And immediately I graduated, I worked in South B for 3 months, then I worked in a salon in town for another 3 months. Then I got the opportunity to work for a manufacturing company, which is Hako Tiger Brands. And that entailed moving around East Africa, talking to hairdressers and telling them what consists of our product and how they should be used. And I realized that we were only dressing the dead part of the hair. But things like we were having a lot of hair loss happening because of genetic issues, because of nutrition issues or deficiencies, and things like even overdoing of extensions, braiding, which is done in the wrong way. And nobody really came out to tell people what is the solution or how can we restore their hair. Yet it's very I mean, it really messes someone's self-esteem when they lose their hair. You might not know it until it happens to you. But I went out and I followed up with the trichology, because when people are doing hairdressing, there is a very short course that is mentioned as trichology. And I said, I want to unearth this. And that's when I got into the internet and really looked for people who are doing trichology and restoring hair. So I got contacts in UK, in America and Australia, and I settled for the Australia training one.
Okay.
And yes, I came back after 2 years of training, and we are restoring hair. People losing hair genetically because of fungal infections or whatever cause it is. Yeah, we are.
Hold on.
Yes.
You've come back with ways to make sure hair can just sit where it's supposed to be sitting and not take off.
Yes.
Hello, my name is Rosa.
Hi, Rosa.
Hello, I have a question for Dr. Muli.
Yeah.
I wanted to know the correlation or the link between scalp expansion and hair loss. Because they say that scalp expansion contributes to the overproduction of a hormone called DHT.
Right.
And so it results to the tightening of the scalp, and of course the decrease in blood flow. So what's the link between that, and can that be prevented?
All right. Thank you, Rosa.
The scalp of a human being has between 100,000 to 150,000 hair strands. That's why some people seem to have more hair than others. And there are three phases there is a growing phase, there is and then there is a transitional stage, and there is a falling stage, which the growing phase might take anything between 2 to 6 years for your hair to grow to its fullest, and then it falls, then it's replaced. Now, when it comes to genetic, because when she speaks about DHT, it's a male hormone, it's the most potent male hormone called dihydrotestosterone. And what DHT does is what triggers the genetic hair loss in men. The more DHT accumulates, then the more your hair thins, because what DHT does, it minimizes the production of keratin, which is a protein that we need to grow hair. So now, scalp expansion and scalp reduction is an old way of doing hair transplants. That there is a device, actually the scalp expansion is that there's a device that would be put underneath your scalp so that it loosens your scalp to expand it. So when you come to cut your skin, because before people started doing the latest way of transplanting hair, whereby we pick single hair follicles and then transplant them to the place you're losing hair, people used to cut strips from your ear to the other, and then they bring it to the area you're losing hair. So by the time they do that, 2 months prior or a month prior, they would put a device that would loosen your skin so that it expands where you have hair. so that when they come, they will reduce the area that you do not have hair and then pull the part that has expanded. Now, when you do that, your scalp might tighten because you've stretched it. It might tighten, and what that means is that there will be overproduction of DHT, and then you might lose hair even in other places. Yeah, there is also, when your scalp tightens, you could your capillaries could actually get thinned, so your hair stops getting enough nutrients. So that was not a very successful way of doing a hair transplant, and that is why there's been a lot of studies, and now we have what is called the follicular unit extraction and follicular unit transplanting, which is the latest way of doing hair transplant.
Follicular unit.
When Rosa asked about the scalp tightening, actually massaging the scalp is also a very good way of really helping it to become, to loosen up and allow blood circulation, like what Carol is saying. It is very important, and again that brings about the question that Carol was answering to when she spoke about how people saying that when you braid your hair it really grows faster, because that is just a myth, and it will never be true. It's like saying if you pull your nail continuously, then it will grow faster.
It will have to grow.
Yeah. So the thing is, if you do a lot of braiding and a lot of weaving, you're just pulling out your hair, and it can cause permanent hair loss.
All right.
But what Carol is speaking about is really, you stay away from the braiding and the weaving for a particular time,
and it can come back.
Yes, and if you do it, don't do it too tightly. And I mean, Carol is here really to direct you on how to do
it.
Gray hair.
Yeah.
And gray hair is kind of tough, huh? It's thicker than the kawa hair, and it never falls off.
Yeah, it's more resistant. Even when you do chemicals in the salon, you realize that if it's color, if it's relaxers, it will take longer for gray hair really to take the product. However, for someone who has thin hair, or they feel that their hair is weak, you know, very many things, when you say your hair is weak, it could be breaking or it could be coming off from the root, and those are two different things. The breaking is hair breakage, and then coming from the root is actually total hair loss. And the thing is, when someone has a problem like that, it is only ideal that they visit a professional or someone like a trichologist, who will then do an analysis and do a diagnosis and say, yes, this is what is happening, and this is the best treatment to it. Because you could be losing hair because you have low levels of iron. You might not be anemic, but the iron storage is low. We call it ferritin. There is a particular level. When it is lower than that, then we see people losing hair. Or it could be your hair is turning from black to brown because you're simply using alkaline soap on your hair. And I always tell men, you're not supposed to use alkaline or soaps on your hair. You're supposed to shampoo it once a week, and the other days just splash warm water on it. And the other thing is hair turning gray again. We've seen in younger people, like in kids who are below the age of 10, if their hair is turning gray and they are not suffering from eczema, then there are those particular nutrients that we look at. We send them for test and we analyze, and most of them you find they're lacking something like vitamin A, vitamin B12, and when we fix that, then they start producing a gray hair. In other areas, someone could have lost hair because of stress. There is a particular type of hair loss we call alopecia areata. When the hair is growing back, then it grows gray, but after some time it turns black. But if hair just starts turning gray at the age of 24 and above, or even some people at 21, when we look at everything, it's okay. It could be genetic, and there is nothing we can do about it other than coloring it, because hair gets its color before it gets out of the
so it's already gray from the root coming out.
Yeah. You know, every case is very particular
and it's unique. The hair on my head is not like the hair on his head. It may look a bit the same, although it doesn't, but there's
we even see patients losing hair genetically, or because they got divorced, and they will say, since I started using this chemical, since I applied this color, is when I lost hair. So clients or patients are always looking at what change of habit did I do, then that is what could have triggered the hair loss, or the change of color in hair, but it's not necessarily true. And I would encourage that before they settle on such a thing, then they get to do an analysis and see, is everything okay?
For sure.
Yes.
Okay. All right.
The key thing is, I always tell consumers, when you go to the salon, you've employed your hairdresser. please insist on having charts that will help you maintain your hair, because it's very expensive when you lose your hair. When you come to see a trichologist, it's pretty expensive. And maintain a balanced diet. It's very important that what you eat, because it directly affects how your hair looks like. And again, the other thing is just to make sure that if you're losing hair, do not start doing try and errors. I've met a lot of patients who have tried all the oils in the world and they expect hair growth in 2 or 3 weeks, because that is what the product really says. And you realize they are treating the wrong thing. You could be losing hair because of genetical problem, and you're using something that is purely for something else. So it's always, when you realize you're losing hair, seek for advice in the earliest opportunity and from the right quarters, and you will keep your hair.